we found that over 90% had seen a GP within months prior to their death, and many in the weeks leading up to their death. And one thing that used to be talked about a lot, and still is that men don't help seek. But actually, what we were finding is women and men were both help seeking, but they just didn't have the services available to them.
Women today are often expected to be everything to everyone. We're caring for children, we are supporting aging parents, we are managing careers, navigating menopause, yet somehow still managing to hold it all together. Or are we? Because research suggests that over 2/3 of women over 50 are struggling with their mental health, but very few are actually asking for help. So why is this happening? And what is the correlation between hormones and mental health? And how can we support ourselves better and our kids if they are struggling? So we're going to be covering all these issues today in this conversation on the Lifestyle Prescription on Pharmacy Planet. I'm Rena Annobil, and I'm just going to introduce my guest to you now. So in the studio with me now is Professor Pooja Saini, who is one of the UK's leading experts in suicide and self-harm prevention. Welcome to the studio.
Thank you. Thank you for having me here today, Rena.
Well, it's lovely to have you. And I've just in the intro obviously said that you are one of the UK's leading experts in suicide prevention and self-harm prevention. And that is quite a niche thing. What made you want to devote your career to this subject?
Yes, I think since I was young, I always wanted to be a doctor, obviously, you know, I'm South Asian.
Yeah.
It's one of the careers. But actually, I always used to say, I still remember being 8 years old, blowing my candles out and wishing to be a doctor. I always wanted to help people.
God,
and I think
yeah.
that was the thing. I then went on and did a lot of practical stuff to do with medicine and thought, maybe this isn't for me. I might go into psychiatry. But whatever happened, I ended up meeting a child psychologist. I'd never heard of psychology. And when she told me about her career, it just was like, you know, when you have that light bulb moment, and I was like, that is what I want to do. And so I pursued a career in psychology. Through that experience, I got my degree. I really struggled to get a psychology post. You know, it's a competitive field, which I wasn't aware of. I ended up working in the Home Office with asylum seekers. And then I ended up working in the Northwest with South Asian women with mental health issues. And I also worked as a healthcare assistant in secure units. And through those 3 jobs, I met a lot of people from ethnic minority backgrounds. And I came across a lot of people who were self-harming or suicidal. And I don't know if that's why I ended up in the field, because it wasn't intentional.
Okay.
I applied for a lot of research jobs because I needed a research job to become a clinical psychologist. And the first job I got was within a national suicide prevention centre. And I've never left. Basically, I dropped the clinical work and continued in research.
Okay. So during these jobs, you know, during your professional career and during your PhD research, did you discover that many people who died by suicide, did they seek help shortly beforehand? Like, what patterns have you seen?
Yeah, so I was one of the first researchers to look at primary care and to look at people who might have gone to see their GP. And I mean, I think we found that over 90% had seen a GP within months prior to their death, and many in the weeks leading up to their death. And one thing that used to be talked about a lot, and still is that men don't help seek. But actually, what we were finding is women and men were both help seeking. They were both communicating that we're feeling suicidal. But a lot of GPs, and there's loads of amazing GPs out there, I think they do get some flack sometimes because they are, you know, the first person. But they just didn't have the services available to them. The only thing they could really say is go to A&E. And if they did call, like, the community mental health teams, they felt like they really sometimes had to overplay sometimes how bad someone was, or they genuinely were that bad, to even get them seen. So I think that really flagged up to me that there's this missing kind of area of services. You know, people shouldn't have to go straight to A&E after seeing a GP, but that was the only option. That was like kind of 20 years ago when I started in this career.
So, okay, so you know when people say things like, "Oh, we never saw this coming," like if they know somebody who has died by suicide, right? So, what are some of those kind of misconceptions, would you say, around that and around spotting issues that somebody is having?
Yeah. I mean, I have to say, I don't think everyone does see it coming. And I speak to a lot of people who've been bereaved, a lot of parents especially, who do say before it happened, they never thought something like that would happen in their family. You know, there's risk factors that you know of. So whether people, you know, might be abusing substances or they've had abuse in their lives or they're from poverty, you know, we know of some really significant risk factors. But obviously there are some people who die that are not kind of exposed to those risk factors. So I think it's those changes in behaviour and sudden changes in behaviour as well, where you might need to just spot that, okay, someone's not communicating as well, or they're not coming out anymore, or they don't want to do anything anymore, or they might be saying, I've gone to get help, but I don't think, you know, I might not be being helped. And the other issue I think we have is if people do go to health professionals, unless they're in crisis, it sometimes is kind of, you know, let's just see how you get on, or you might be offered antidepressants or something. And yeah, I think we need a lot more exposure for people to communicate and have their feelings validated. I think that's really important.
Absolutely. And we'll talk a bit about that later on, about things that we think should improve in the healthcare system to kind of catch this. But I want to just kind of clear up the fact that this is actually happening to more people than we think, suicidal thoughts and self-harm. And I'm saying that because through my work interviewing people, having these conversations, I know at least 2 or 3 people who, you know, you would never think that they would have these thoughts, and they're open about the fact that they've tried to take their own life. Yeah.
I mean, we know of the statistics of how many people die per year. So in this country, you know, it's around 7,000 people a year now. It's gone up. Globally, it's like, you know, 800,000 to 1 million people. We also know they're underestimates of how many people actually probably die by suicide. But beyond that, there's way more who feel suicidal or who find themselves in a suicidal crisis or who might be self-harming. And if you've got any of those things, you're at increased risk of potentially, you know, taking your own life. So I think there's way more people in our community than we realise who do have these thoughts or who are self-harming. So it's, you know, we need to provide a culture, a community where we reduce the stigma, and that's what I've been trying to do with my work, so that people can talk about it and hopefully get the help.
That's a lot of people, you know, that's a bigger number than I thought, what you just told me.
Yeah.
So tell me that number again in this country, the people that are...
So I think they say every 40 seconds somebody may die by suicide.
Wow.
I think that's what's kind of put out there. So yeah, it's high, and some people might say, well, you know, 3/4 of those suicides are men, only 1/4 are women, only 200-300 are children. But what they don't remember is the impact of that. So if one person dies by suicide, up to 135 people can be affected. Their school communities, their work communities, their families, their friends, the people who may find them. You know, whether it's police, ambulance, train drivers.
Yeah.
You know, I've got friends who work in the train service who have talked about how traumatic it is. You know, if that's what's happened in their day. So yeah, I think a lot more people are affected than people kind of realise sometimes.
Lasting impact.
Yeah.
So I just want to talk specifically about women for a moment, because many of our listeners may be navigating unique challenges that can affect their emotional well-being. So how significant is that relationship, would you say, for women with their hormones and mental health?
Yeah, I mean, this is an area I've more recently come into in the last 4 years or so. A lot of my work was focusing on men, then young people, and now women. But I had Dr. Louise Newson contacted me via email and said, you know, I've got a lot of women coming into my private clinic who are in suicidal crisis. You know, is this normal? Kind of thing. And then I still can picture myself sat at my desk and thinking, oh my God, you know, when I worked in the National Confidential Inquiry looking at data for people, the highest risk group for women was 45 to kind of 50 or 45 to 55. And you know, when you just kind of have that moment and you think, okay, is this actually not a coincidence? And that's the age where women are coming in with perimenopause and menopause. So I contacted her back and kind of we started having conversations about it. And then we kind of thought about, well, how do we capture this and see, is it actually happening? Or is it just, you know, it's a coincidence, it's a few weeks, some people have come in. So we embedded some tools in there that, you know, validated measures to look at suicidality. And then we looked at the data after a year for around 1,000 women. And 1 in 6 women were coming in suicidal crisis, which was much higher than what I expected. But on a positive note, with hormones, and some of them having a combination of hormones, and especially when testosterone was in the combination, we saw reductions in depression, anxiety, kind of hopelessness, and for some who came in with suicidal thoughts, their suicidal thoughts reduced as well. So I think, you know, it's not a case of scaring women and saying loads of women are going to be in suicidal crisis. I think it's about, don't be scared if you do find yourself in a dark place, and seek some help and maybe have conversations about, is it your hormone changes that may be affecting this? Because what we were finding is a lot of women were going to see their GPs or gynecologists, and they were being put on antidepressants and having some quite negative reactions and ending up maybe being sectioned or having attempts on their life. And, you know, I'm an advocate for kind of antidepressants or other medications if that's what you need. But I think what's happening in some cases is the issue is the hormones, and that's not being addressed. So no matter what other medication you give, if you're not addressing the issue, which might be the fact that their estrogen levels have plummeted so much, and that then affects your serotonin, you know, and your mood and your emotions, if you're not actually addressing that problem, then you're not going to be helping those women, where the actual issue is more their hormones. So some women might need both things. But what many women I've spoken to have said is once they were on the hormone treatments, the suicidality kind of went, and they just started to feel back to themselves. And these are women who have got really good careers, they've got families, they haven't got those risk factors I spoke about, they've not maybe had mental health issues in their life, and all of a sudden they found themselves in this very, very dark place, which must be really frightening, you know.
Okay, so the women that were in your part of your study, were they given HRT then?
So some were, some weren't.
Right.
So
okay.
the women who we looked at the data for had all gone to a private menopause clinic. So majority of them were on some combination.
Okay.
And we did check whether they were already on HRT or whether they'd started HRT, just to check for those effects. But we also did interviews, and we did around 50 interviews, and half were with women at the private clinic and half were with women from the general population. And the reason we wanted to do that is we wanted to see, you know, are women who aren't going to clinics having the same experiences, or is it different, you know, and are they managing to get the right help? But what we found is pretty much all of the women were saying very similar things, that they were having issues when they were going to health professionals. They didn't feel heard, they didn't feel validated, they felt like they were being misunderstood or just told it might be stress, maybe given alternative medications or told to go for a walk, have a bath. And many women get really frustrated with being told that, you know, this is a stressful time of life and it's just stress. But I think I've had a lot of issues as a woman with female conditions. I've got endometriosis.
Okay.
And, you know, I've not had issues with suicidality or self-harm, but I've had female-related issues where I haven't been listened to. And I've purposely then gone to see a different gynecologist who thankfully did diagnose my endometriosis, and I managed to have it seen. But even when it came to decisions about what kind of hormones I should be taking as part of contraception or HRT, it's always felt like a little bit of a battle. But it's kind of like, I know what works for me and my body. And it's taken, you know, whether it's a year or months or a few years to actually get the right treatment that suits me. So I can't imagine. I'm educated. I'm born in this country. I research. So I'm still in a better position than many women, where I think a lot of women haven't got the confidence. They can't advocate for themselves, and they're just being turned away. And that can't be good for your mental health as well.
Yeah, what impact does that have on your mental health, just not being listened to?
Absolutely. I think it's really negative. And then also, on top of that, we come from a culture, and I don't just think it's South Asians, I think it's other cultures as well, where you just kind of, you know, you'll get told, well, I didn't have HRT, your grandma didn't have HRT, we all got through it.
Yeah.
And I kind of try and educate my own mum now and say, well, you know, you've had loads of bone issues. Maybe if you had HRT, we don't know, it might have actually helped some of these other issues you have had as you've been getting older. But I feel with what I've educated myself about is that this is a good decision for me and potentially my future years. You know, when I'm getting older, and we're all living longer, hopefully.
Yeah.
I don't want to be living in ill health.
And that whole thing of you should be able to cope because I coped, right?
Yeah.
I've experienced that myself, right? And
Yeah.
you know how you were saying things about hormonal changes and feeling a sense of anxiety and a low mood that you haven't felt before. So, I mean, I guess I fall into that category because I don't normally talk about this kind of thing, but I'm just being honest because I want I want listeners to know, you know, what impact this being perimenopausal, right, basically has on mental health. Because I've not had suicidal thoughts, you know, but I've been like gripped by a sense of anxiety and from opening my eyes in the morning, you know. So, and I've not had that before, and it's like, whoa, what is going on? And so I totally understand that. Now, we've spoken about hormones, and obviously there's things that people can do whether they want to go down the HRT route or not. But then that area of life, the midlife area, right? So that phase of life, as I said in my intro, sometimes you're still caring for kids if you have kids, okay? Even if you haven't got kids, you know, you might have a career and you might have parents who are getting older. Your hormones, right? You've got to deal with that as well. So that's a lot at one time. You know, you may not be where you want to be financially. The world is expensive, right? So there's all these things. Do a lot of women just feel a little bit lost in that time? Or do you see this?
Yeah, I mean, I talk a lot about the sandwich generation that we are, and you know, I fall into that category. And it's really kind. I have a lot of women who say to me, "My God, you're like Superwoman, and you do so many things, and you're so successful." And it's kind of like, yes, I do, and yes, you get to see all that stuff. That's what's online. You know, one of the things of my work is to try and create good impact. So I do put things online, but what I explain sometimes is you don't see how much self-care I do behind the scenes as well. So, you know, I've made a proactive choice not to be at all social gatherings, not to have a huge social circle where I feel obliged to kind of always go and then do back as well. I've made a conscious decision to play golf. Is one thing. All my family play.
Love that,
But the reason I play is for my well-being, because it's 4 hours where I don't look at my phone. I'm in nature, and I know the work I work in, and I go to conferences a lot, and they're very, very intense emotionally. I'm quite drained after I've heard so many people speak about their suicidality and all of that. So you need to make those conscious decisions. So again, I'm very fortunate. We've got four parents, you know, my in-laws and my own parents. I've got three teenagers who are very tasking and demanding and wonderful. But, you know, it's a lot of pressure. And me and my husband are very much the kids who they will turn to as well, whether it's our kids or whether it's our parents.
It all sounds familiar to me, very familiar.
I'm in a job where I'm now at professor level and there's more expectations in my working place. Okay, well, you've been given this level now, you know, what else can you do within the workplace? And I enjoy that. I enjoy mentoring and things. But there's a lot of women who, you know, they struggle, I think, to manage all of that. And I'm not surprised. It is difficult, but they may not realise, and I speak to friends about this who do openly talk to me about being suicidal or self-harm or having children who are going through that you sometimes need to make conscious decisions of the things you're not going to do to allow yourself the space to, in a way, recover on a daily basis or a weekly basis so that you can keep yourself well. And coming into my 40s, I started going through perimenopause as well, and the kind of physical symptoms and the kind of anxiety, which you mentioned. It was really bizarre. Yeah. I'm really not an anxious person.
Same here. And I was like, what is happening to me?
Yeah. And I'm really confident. And I was like, this is awful. But it was really horrible how it affects you physically.
Yeah.
But I think I made a conscious decision. I'm 47 now, in my early 40s, that, everything's about well-being. I mean, I go for massages every 8 weeks or something. I'll have facials. That's where I spend my free time doing well-being things, whether it's working out and things. And I think, unfortunately, for women, we want to do everything. We want to be the best daughter, wife, mother, colleague. We put too much pressure, I think, on ourselves. And I think that's what I'd advocate to women is you need to not put so much pressure on yourselves, because it's like a ticking pressure pot. We talk about we've grown up with our dal pans, haven't we, with the smoking pressure cooker. I know, it's like that. And I think we become that pressure cooker. We've got to learn how to let out the steam, essentially.
I mean, I'm really happy to know that you are taking steps, and you have taken steps to manage your mental health. Because before this, I was doing my research about you and about this topic, and I did think to myself that Pooja is probably having a lot of conversations which are really heavy, you know what I mean? And everything is kind of seeps into you, right? And I was wondering, how you protect yourself, because all your work is about self-harm, suicide prevention. So I guess that it makes sense that you do focus so much on self-care. Has there been times, though, where you've gone home and it's still in your mind, the things that you've had to just face at work and research?
Yeah, I tell you what's been very difficult for me is there was one stage a few years ago where I literally had 3 friends, very close friends, calling me about their daughters being suicidal and self-harming. And that was difficult, because I was like, they're people I know. And I did all the right things of the signposting, following up as well, but seeing my friends deteriorate as well, the mothers, at the same time, and how they were unfortunately treated by services, in the sense of kind of left to manage this stress on their own. And sometimes the mothers indirectly were getting blamed as well. And obviously I knew them, so I knew that wasn't the case. And it was really, really difficult to see and manage, and to go to sleep at night thinking, I know that my friend's daughter is literally at crisis point here and having overdoses, or, others are thinking about things and that are really, really dark thoughts. So that was really difficult, actually. And I had to speak. I've got a friend who's a therapist who I recommend, and I recommend it to all of these friends, actually. But I'd say she's kind of a friend / therapist sometimes when I need her, and I'm the same for her. And I think she's my go-to. And she kind of gave me permission to say, right, you need to not answer the phone every time. And maybe you send a text and just say, I'm busy at the moment. And that was really kind of, I don't know, it's really funny that you need permission sometimes to kind of think, this is getting a bit overwhelming now. And I can't talk to 3 different people in the same day, every day, for weeks, because it's taken a toll on me and my family now. So yeah, I think you've got to sometimes give yourself permission to say, right, I'm not going to answer that phone call, or I'm not going to check up every day. And it's not my responsibility to have to do that either. I've signposted, I've done what I can. But, you know, still checking in as and when, but doing things for myself in between.
Will you make yourself ill otherwise?
Well, I think I was getting to that point.
Right.
Where, and then it affects your own home.
Yeah.
Which I think that's when it's the wake-up call, isn't it?
Yes, exactly.
Yeah.
There's only so much that you can do. So, you know, you mentioned there about young people, and I do have some questions, which I think is a good time to talk about that now. Young people, a lot of your work has been around young people, self-harm and suicide prevention. So, are you seeing some growing mental health challenges at the moment amongst teenagers?
So I think, you know, the transitions that young people have is when I think parents need to be really alert. And I had some parents asking me recently about schools for their children. And, you know, my kids go to 2 different schools and things. And I said to them, I said, look, I need to be honest with you, whether your child goes to a private school, whether they go to a grammar school, comprehensive school, what they really need is parents to be there and to be able to give the time where you do notice there may be changes in behaviour. I think sometimes we're all so caught up in whether it's work pressures, you know, socialising. We're always busy now. We don't really stop, you know, and take time. My advice would be to parents, make sure you are around to spot those signs, if you can be, you know, with your children, if there are changes in behaviour. Transition, so when they go from primary school to secondary school, that's when we see the first conversations happening. I mean, in all 3 of my children, when they were in year 7, there was a child who put on the new WhatsApp group that they either wanted to die, or that they wanted to kill themselves, or that they wanted to die by suicide, or don't want to be here, or other kids telling people to die. You know, so as much as we think we want to keep our kids in a cocoon, these conversations are happening. So we need to have an open dialogue with our kids. Like, thankfully, I work in the field, and all 3 of my kids told me, and I then contacted the school and said, look, you know, I just want to let you know that this child has said this on a group. It may be nothing, but you should be aware.
Yeah.
And then exam times. So my friends I mentioned earlier, all of their children were about to go into GCSE. So it was kind of probably year 9 where you really saw these thoughts either getting worse or them actually doing some things. Thankfully, they got the help they needed, and I signposted them to things like Papyrus, which is a national charity for young people in suicidal crisis, and they also support parents. They've got a 24-hour helpline. You know, you've got Samaritans, which I know some of them have used. You've also got crisis lines for the NHS. Obviously, going to see a GP. I will always advocate people should go and get help. Speak to the school. You know, not all are great at their response, but some are really good. So you've got to just work together, and hopefully you can work together to keep the child well. And also, I think just giving children the confidence and the space to talk about how they're feeling, not kind of dismissing what they're saying, or, you know, don't not validate what's coming out their mouth. Don't say, oh, you're being stupid, or don't be silly, or, you know, why are you thinking that? You've got everything. You know, I think you've got to give yourself space to just let them say what they're saying, even if it's frightening for you, even if it's scary for you, or even if you think, well, why? You know, and you can't understand why. You need to then get help separately in a way for that, whether it's through friends and family or literally going to get your own therapy as well. I think it's really important. And another element, just to say, is neurodiversity. You know, whether it's ADHD, autism, other diagnoses, if your young person has those diagnoses or has those tendencies even,
Right.
the risk of them having suicidal thoughts is much higher.
Okay.
The representation in young people going to hospital for suicidal crisis or self-harm is massive in groups where there's a lot of childhood trauma or where there's neurodiversity. So I think that's something just to be aware of. And then I think the final thing is just not being scared to ask your child, if the conversation's going that way, to ask your child, are you having suicidal thoughts, or are you feeling like you want to harm yourself, or things like that. There's a myth that it will make somebody think about it. It really is a myth. And I think a lot of the time people are relieved. And I've been to so many weddings and things where people have come up to me and started talking to me about a sibling who's died by suicide, or the fact that they've had suicidal thoughts in their life. And I'm kind of like, I'm in the middle of a wedding here, dressed up in all my stuff, and a bit kind of like, okay, how do I react to this? But I think because they know I work in the field, there's no judgment. And I'm probably sometimes the first person that I remember a wedding when a guy came up to me, and he's the husband of a girl I've known all my life. It was so random, like we don't know each other that well. And he said, I've been out for runs loads of times where I've run to the end of like a kind of a cliff or a mountain and thought about it, and or a bridge. And I was kind of like, and I just said, are you okay? Are you all right now? And he was like, yeah, no, I'm fine now. But I just feel like I could bring it up. And he was complimenting the work that I'm doing. But I just feel like the stigma's not there, and they know they're not going to have any judgment. So I think providing that atmosphere in your home is really important, or in school, wherever young people hang out, really.
I do know people in my close circle who from time to time, when things get difficult, do say things like, what's the point of being here? Yeah. I'm going to do something to myself. Okay. Now, is that just some people's coping mechanism? How worried should parents and carers be about that, or family members? Or on the flip side, when your child goes quiet, if that person then goes quiet at those stressful times, is that more of a worry?
Yeah, well, I'd say, so the first thing about people who maybe communicate that they don't want to be here, or that they're in crisis, I think you've always got to take it as face value, that for whatever reason they're in crisis. There's some people I've met who, I work in research, and people have to complete questionnaires, and we have to check if it's safe enough for them to be in our studies. Now, because I work in suicide and self-harm, there's some people who literally on every questionnaire say that they're suicidal. So we can't exclude them from the study because it's about suicide prevention. But when you speak to them, they say, well, I'm always suicidal, but I've learned to live with it. I've learned to manage with it, and maybe they've learned coping mechanisms. So we talk about safety planning in the field. So if someone's in crisis, you kind of have a safety plan in place, and that might include, well, what do you do to help yourself in that situation? What are the activities you might do? People might go and watch movies, they may go for a walk. They've got their own things. They may go out with certain friends, or they may withdraw, actually. So I'd say when, we were talking about us sometimes having anxiety or feeling a bit low, my thing is to just go and watch a Netflix series or something, and just kind of have some downtime. So people have got different ways of coping. Yeah. So maybe they've naturally got their own safety plan that they have, but they're quite vocal about how they're feeling. But I wouldn't say that what they're feeling isn't true, if that makes sense. I don't think they're saying it for attention or to get a reaction necessarily from people. But if people feel like they are doing it for that reason, maybe it's a case of asking those people directly. So if you go on suicide prevention training, like the assist training, you're educated to say to someone, are you feeling suicidal? Are you having thoughts of harming yourself? And asking a very direct question so that they can answer you. They might feel quite relieved to be able to say, oh no, I have these thoughts regularly, but I'm not actually planning to do anything. And then okay, they're in a safe place. On the flip side, what we've heard some people say is when they've asked that question, someone has actually realised, oh God, I am having suicidal thoughts. This is serious and I need to get some help. So it can have two different effects. And then I think for what you were saying about people who may fully withdraw, again, I think, if I look back to my own children sometimes, and I might see their behaviours changed in a couple of evenings, they've gone a bit quiet or they're a bit more ratty. I've always had a policy with my kids. I have to know your codes on your phone and I need to be able to access them whenever I want, and your apps and everything. Once they've got to kind of 16, I don't really go on anyone's phone, to be honest. I don't want to see some of the stuff on there after that. But when they've been younger, I have gone on, and I've gone on to Snapchat or I've gone on to things, and I've seen they've had an argument with their best friend. And then I've gone in and said, I've seen that why didn't you tell me you're arguing with your friend? So they know how I know. They've never questioned how I know. And I felt like sometimes they've been relieved that I've actually checked their phone and I noticed that were a bit different. And then they've had a good cry and told me everything. And, we've talked through things, and then they've maybe gone and spoke to their friend the next day, and eventually they normally always make up. So, yeah, I think having things in place yourself where you notice, and again, I think it comes to that time and space where you actually can be observant a little bit.
Yeah. If somebody notices that somebody in their family or friend circle has been self-harming and they're trapped in that cycle of self-harming, or maybe even somebody who is watching this might be in that cycle, how to come out of that cycle? Like how long does it normally take somebody to kind of break that pattern?
Yeah, well, this is an area very close to my heart in the sense of research. There really is not good pathways for people who self-harm when they go in to get help from health services, and we need to improve the kind of access to kind of services that are directly for self-harm. So I work with colleagues in the field where we're trying to implement pathways for self-harm. So I've done research in primary care. And, they were having a brief intervention. So this is a study where anyone who self-harmed within the last 6 months who's gone to their GP could enter the study. And we actually had overrepresentation of young people, especially university-age students. But what we found is it was a brief intervention, so 4 to 5 sessions, but what they kept saying is this is the first time we're getting to the root of the problem.
Right.
And you heard that phrase all the time. And I think what the advantage was in what the intervention included is the first session talked about the self-harm, what got you there, and when are the times when you really feel like you're going to self-harm or you do. And I think by talking through that, some people start to understand the patterns or what's going on in their life and what it is that may drive them to feel like they need to self-harm. So exam stress we'll use as an example. It could be every time they've got a test coming up. And it's kind of like then thinking about, okay, well, what can we do to put in place? Or what did you do the time when you didn't self-harm, but you still had those feelings? And really working with people on that. And within some of those therapies, you co-produced like a mind map. And a lot of people said they'd use this mind map later, or in suicide prevention crisis centres where, I've done a lot of work, you do safety planning, and a lot of people say they use the safety plan months down the line when they're back in crisis again. So I think it's allowing someone the right therapy where they can actually think about what is it that keeps making me want to self-harm, and then what are the things that need to be in place to help them in that moment.
In terms of conversations that we can have with our children or family members or friends, what are some of the things that we should be saying, and what are some of the things that we shouldn't be saying?
I think we shouldn't be saying, oh, don't be stupid and don't do it. And we hear about a lot of nurses when people go into A&E saying, well, that was a stupid thing to do, wasn't it? And, you're basically creating stress for people, and or you're so beautiful, why are you doing that to yourself? Okay. And I think coming out with comments like that just don't help. I think asking somebody why they feel they need to, having those conversations when they're ready to as well. You know, you can't force a conversation just because you want it and you want to understand. But I think to keep allowing them the opportunity to speak and letting them know it's safe to speak to you, and you're not going to judge them, and you're not going to think bad of them because they're doing this, and hopefully together to try and get them help. You know, you can't manage this yourself either.
Yeah. In terms of getting help, you know, if somebody is themselves feeling very overwhelmed, and having thoughts of self-harm or taking their own life, where do you think that they should go for help? What's the first port of call?
Well, I think speaking to people around you. So, you know, if you are in school, you may speak to your pastoral staff or other people you're close with, your family, obviously, if you've got family you can speak to about that. A lot of people go to their friends, but the thing with going to friends, especially for young people, they're then holding that. So speak to your friends, but don't ask them to keep it confidential, because sometimes maybe they can go and get you the help they need. And I don't think it's good for young people to be managing that on their own. So, you know, always advising people to get help from a trusted adult, and maybe people who are trained at working in the field. So, you know, obviously going to a GP. Unfortunately, in many cases, I've had to advise my friends to get private counselling or therapy for their kids because the waiting lists are just so long. You know, we need to improve services for when people first come in and say this is happening. We shouldn't have to wait till someone's been self-harming for years and they're at crisis point. You know, as soon as someone comes in and says, I'm thinking about self-harming or I am self-harming, there should be appropriate support available to them.
I just want to clear up some myths and misconceptions about suicide and suicidal thoughts. You know, I did read something that some people think that asking somebody directly about suicidal thoughts can increase risk.
Yeah, that is definitely a myth. And, you know, from what I've seen in our research, people normally find it really cathartic to be able to speak about their experiences. You know, we have to go through a lot of ethics to get ethical approval to conduct our research, and we have to keep advocating to our ethics departments that, you know, most people who take part in our research, it's the first time they've been able to speak about all of this in a non-judgmental way, and they actually feel better afterwards. You know, and we've had trials where some people get therapy and some people don't, but even the people who don't have found it helpful because they've had someone to speak to, whether it's just a researcher. So, you know, I think being able to speak about suicidality and your suicidal thoughts, I think, is a relief for many people. So I think we need to remove that myth. We need to remove the stigma that we can't ask.
Do you think that a lot of people are suffering from loneliness at the moment, and it's making the mental health crisis worse?
Definitely. I think loneliness it's a pandemic of its own. You know, there's so many more people who are lonely. We hear about, you know, in this country as well, we spend a lot of time alone in our rooms. Even if we've got a family in a house, you know, we try and consciously have dinner together at least, and do some activities together. But you can go days, weeks without having conversations. Whereas I've spoke to some friends who did work in Europe recently, and they couldn't get over how, you know, communities, the whole street comes out and eats at the same time. And people are not on devices. They're not watching TV. They're literally conversing, and how different it is. And I do think we're losing that a lot, even within our own Asian culture. I think that was a really good thing. But I think it's reduced, you know, and when we do come together, I think that sense of well-being, and, you know, I joke about sometimes seeing friends or certain family members, it's like a happy medicine. It's like a happy potion you've just had. I think we need to definitely work on being less isolated, but it's really difficult if you get into that place and, you know, you might not have family, you might not have a partner, you might not have children.
Yeah.
You know, it's very, very hard.
I mean, I do worry about young people because of they're kind of, a lot of people are replacing interaction with just watching things on screens, and I just worry about it. because it can be a lonely place, even though technically you're interacting with loads of people over there in different parts of the world or wherever.
So we've both got kids who will soon be maybe going to university. Yeah. I don't know if you stayed away for uni or went to uni.
Yeah, I did a little bit, yeah.
So I did as well. And I mean, I cannot imagine any of us staying in our room to watch Netflix. We were constantly together, whether it was in one person's room, whether it was in the common places, whether it was outside, whether it was out.
Now, too much. But I was a bit too much outside.
Well, probably me too.
But it was healthy though, right?
But we studied together, we ate together, we laughed together. You know, it was very rare that you were on your own. I've got nephews and nieces now who are in university. I can't get over how much they phone us, you know, and phone the whole family. I can't get how much they watch series on their laptops on their own in their room, and they'll say sometimes, oh no, you know, yeah, there's people in the flats, but we're all doing our own thing in our rooms. And I'm obviously a personal tutor in a university as well, and there's been so many occasions where I've advised my students to, please, can you go out this weekend? Can you go make some friends off your course? I meet loads of psychology students who don't know anyone on their course.
Wow.
And they just seem sad and lonely. You know, they might be getting first in everything, but I'm like, that is not the be all and end all. You need to get some friends. And I feel like I'm really nurturing, you know, like a mother figure to them. But I find it really sad when they come and tell me they've got no friends on their course. I mean, psychology is a huge course. There's always at least 200 students on there. And some people have got to their third year. And I'm like, I just can't imagine that that's what university might be becoming like for some people. And then you hear about a lot of students having worsened mental health nowadays. And I'm not surprised. You know, and I speak to my son about this. He's about to venture to uni next year. And I'm like, you know, if you ever feel down, you need to call. We'll turn up. You know, make sure you join societies. Make sure you go to the gym. Make some friends on your course. So I'm trying to preempt. But the biggest thing me and my husband speak about is we worry about them being lonely when they go away because they've not made friends. Because it's different now. It is.
Yeah, I mean, I'm really shocked, and it's been a long time since I went to uni, so that is quite shocking and quite sad to hear.
Yeah,
that it's quite different.
Yeah,
there's no substitute for human interaction, is there?
No, but there's many who do it the way we did.
Yeah,
you know, just to keep it kind of, there is a balance.
Okay,
but I think there's a lot more who have the opportunity now to be on their own a lot more.
Throughout your career, Pooja, what is a single message that you want people to understand most about suicide prevention, if there is one?
It's as soon as somebody says, I am having thoughts of suicide, self-harm, or I've done something, you get them help. Literally, you do not put them on a waiting list. There should be crisis support available straight away and appropriate support. That's kind of what my career goal is that that's the place we come to. And I think that will be the most preventative measure that we can put in place.
And if every listener or viewer could do one thing after hearing this conversation to support their own mental health or someone else's, what would it be?
I think, you know, like I said, giving yourself space to look after your own well-being. And if that means for a woman that you feel like you're being selfish, be selfish. I say this all the time. You know, we shouldn't be selfless about absolutely everything and put everybody else's needs before our own. If we're not well, the whole family unit, you know, collapses. So we need to keep ourselves well, so that we teach our daughters as well that this is important. You know, I think our sons know that anyway, and they are treated differently. No matter how much I think we try not to do that, but I think we need to educate our daughters and the next generations of women. You have to, yes, aspire to do all the things you're doing, but look after yourself while you're doing it.
100%. And bin that superwoman thing.
Yeah.
The superwoman thing, like, no.
I don't want to be superwoman.
No.
You know,
I'm just,
it's a compliment. I
well,
get it.
Exactly.
But I don't want to be a superwoman. I want to be someone who achieves things with balance, you know?
Yeah. And I want to have days where I'm actually not very nice, but I'm not going to let that sit in me and make myself ill.
Yeah, exactly. And you've got to speak your truths and you've got to stand up for yourself. I mean, I think it's difficult for women anyway to stand up for themselves. But I think when you add in Asian women, it's even harder. I mean, I went on a leadership course for women, and by the end of it, literally the closing sentence was, so things are getting better for women. But if you're women of colour, I'm sorry, it's not getting that much better.
Wow.
And I just sat there and thought, okay, great. Thanks for that. So I just think, yes, we know we've got to work that a little bit harder, and we deal with some other kind of intersectionalities that can be quite difficult. But even within that, we've got to look after ourselves. We have to.
Absolutely. So Pooja, I just want to say thank you so much for coming on the Lifestyle Prescription. And before I let you go, as it is the Lifestyle Prescription, we usually end with a lifestyle prescription. Is there something that you have personally started doing, however big or small, that has improved your health or well-being that you want to share with viewers or listeners?
Yes, I mentioned before I play golf and I love it. So the social interaction, the fact I don't look at my phone, the fact I'm in nature, and I do that a couple of times a week. And I think find your go-to activity that can just help you wind down and, enjoy the present moment.
Thank you so much.
Thank you. Thanks for having me here.
So thank you so much for tuning in to the Lifestyle Prescription on the Pharmacy Planet. I hope that you have found this episode useful. Thanks again to Pooja for sharing your passion and your expertise, and also giving us some hope as well. Please do share this episode with somebody who you think might find it useful. Don't forget to like, subscribe, and I'll catch you on the next one. Thank you.